Let's talk about white blood cells or leukocytes. So there are 5 different kinds of leukocytes, which form the buffy coat, part of the buffy coat. So these are produced only when needed. So they are classified into granulocytes and agranulocytes. So cells with granules, right? Those are granulocytes. So there are 3 kinds: neutrophils, eosinophils, and basophils. Neutrophils are the most abundant of the leukocytes. So you have about 50 to 70% of the white blood cells comprised of neutrophils. Neutrophils are the first to arrive on the scene of infection, and they are killed within 3 to 7 days after their work is over. And neutrophils are followed by lymphocytes, which are 25 to 45% of the blood of the total WBC count, followed by monocytes, which is about 3 to 8%. Eosinophils and basophils are very rare to find, and they are produced only during special circumstances. For example, eosinophils are found when there is infestation worms infestations, and basophils are found during allergies. Okay, so going back, neutrophils, okay, these are cells which take both the stains, red and blue stain, so that's why they are neutral in color or purple in color. So these are the granules which accept the stain. So if the granules accept eosin or red stain, these are called as, they are red in color, the granules look red in color. Or if they accept the basic stain, which is blue in color, those are basophils. And if they accept both, they're called as neutrophils. Lymphocytes and monocytes do not have the granules, and we have other ways of identifying them. So if we, so dividing them as granulocytes and agranulocytes. There are about 11,000 WBCs, and if it is more than that number, then it is a sign of infection called as leukocytosis. Could be infection, could be blood cancer. And if we group them according to most abundant to least abundant, those are neutrophils, lymphocytes, monocytes, eosinophils, and basophils. So you can remember them as never let monkeys eat bananas. So in the slide of blood smear, you can see neutrophils. There are 2 neutrophils. Neutrophils are easily identifiable by having multi-lobed nucleus. And lymphocytes, this is a large lymphocyte. Normally, lymphocytes are about the size of red blood cells, and you can see that the nucleus covers almost the whole cell. Monocytes are bigger, much bigger. These are the biggest leukocyte, and you can see they kind of look like dumbbell shaped. And these monocytes are notoriously known for becoming macrophages. So in some slides, you can see them with irregular plasma membrane. They have become macrophage. These little fragments of cells are called as platelets. So I'll be showing you some more slides. For example, here are the 5 different kinds. So these are the neutrophils with multi-lobed nucleus. And yes, the granules are purple in color, but it's easier to identify with that multi-lobed nuclei. This is like a telephone receiver, right? So you have 2 big blobs connected by a thin strand, and you can see that the granules are red in color. That is an eosinophil. Basophil, it's hard to discern the nucleus. All you can see are the blue granules. That is a basophil. And then lymphocyte, almost the size of the red blood cell, where you have the whole nucleus covering the cell. And this is a monocyte, where again you have this dumbbell-shaped or kidney-shaped nucleus. Okay, so easy to identify. All right. So when we look at the neutrophils, they are the most abundant. They make about 50 to 70% of the total WC count. They are twice as large as red blood cells. They are multi-lobed. They do stain with both acidic and basic dye, giving that purple color. Their nuclei form about 4 to 6 lobes, and they contain small granules which act like lysozymes. So these are antibacterial um, enzymes, and their main job is to come to the scene of inflammation or infection to destroy the bacteria. So these destroy by spraying like a bleach-like substance, and that is called as a respiratory burst. So they spray these lysozymes, sorry, and defensins and kill the bacteria. So those are antibacterial um, liquid that they spray, and they can be active phagocytes. When we look at eosinophils, eosinophils are almost the same size as neutrophils. They are not very abundant. They take the acidic stain, so they are red in color, and they look like old-fashioned telephone receiver. The nucleus of the eosinophils. Um, they contain lysosome-like granules, but they don't attack bacteria. They don't have that enzyme to attack bacteria. They're mainly used to destroy parasitic worms. All right. And then basophils are the rarest, and they stain with basic dye, giving a purple color, almost blue color. And their cytoplasm contains histamine-producing granules, okay, which are produced when injured to dilate the blood vessel. Coming to agranulocytes, so we have lymphocytes, which are next in neutrophils in abundance, about 25% or more. They are not found in the blood, rather they are found in the lymphoid tissue. So they leave the blood to enter the lymphoid tissue, giving the name lymphocytes because they are found in lymphoid tissue. And the nucleus fills up the most of the cell. There are two kinds of lymphocytes, T lymphocytes and B lymphocytes. They, they play a very, very important role in immune system. They have the whole adaptive immunity. We'll be talking about, when we talk in immune system, we'll be talking about the second part, or there are two parts of immune system. The second part is completely ruled by the T and the B lymphocytes. So T lymphocytes can attack the cancer cells or virus cells directly, whereas B lymphocytes give rise to plasma cells, which produce antibodies. Okay, so we'll talk about this in more detail. Monocytes are bigger than lymphocytes. Their main job is to turn into macrophages, and these are largest leukocytes, and they're very, very actively phagocytic. Okay, so they do have an important function in immune system by cleaning up the debris. Like, so after the neutrophils attack and kill the bacteria, macrophages come and clean up the area by being phagocytic. So this is a nice table where you can read all this important information that I just talked about. So you have all these, or if you like my table, you can read that as well. Okay, let me see if there's anything else in this. Oh yeah, leukocytes are also produced by chemical messengers like erythropoiesis. This is called as leukopoiesis. And leukocytes are normally produced when there is an injury or an inflammation or infection. And there are some chemicals that are produced by injured cells called as interleukins and colony stimulating factors. So these are produced by macrophages and T cells, basically. And once these are produced, they signal the bone marrow to produce leukocytes. So EPO and CSFs, EPO is erythropoietin, CSF is colony stimulating factors, are given to chemotherapy patients to stimulate the bone marrow to produce all kinds of blood cells. So these also arise from the same hematopoietic stem cell that we saw for the red blood cells. So under colony stimulating factors, they form these colony forming units. So these are like the precursors for lymphocytes, monocytes, neutrophil, basophil, and eosinophil. If you see these three, in fact, these four, they come from the same lineage. Okay, so they are produced, even monocyte, But if you see the lymphocyte comes from a completely different line called as lymphocytic CFU, and this is going to produce like the B lymphocytes and the T lymphocytes and natural killer pro-lymphocyte, and that produces these cells. Okay, so the lineage is common for these four, but is different for lymphocyte from the beginning. So and you can see that these are all blast cells, which are like young growing cells. Once they become cyte, that is more of a mature cell. So cancer in these blast cells are acute, okay, so they can produce cancer cells very quickly. Whereas if it affects one of these, then that is more of a chronic leukemia, much slow in progression, but once they are discovered, right, normally they are found at a very late stage. By that time, it has already metastasized, right? So the numbers are pretty similar to what we would find in an acute blast leukemia. So again, this is another picture that I really liked, so I just posted this. So this shows actually all of it. So megakaryocyte, myeloid stem cell, there you go. Myeloid stem cell producing megakaryocyte, which produces the platelets, erythrocyte, mast cell, myeloblast. Myeloblast produces your basophil, neutrophil, eosinophil, and monocyte, which can give rise to macrophage or dendritic cells. Then you have the lymphoid stem cell, which is a completely separate lineage that gives rise to natural killer cells and small lymphocytes. Small lymphocytes are differentiated into T lymphocyte and B lymphocyte. B lymphocytes form plasma cells, which produce antibodies. Okay. Leukocytic disorders, abnormally high numbers of WBC count is called as leukemia, and low count is called as leukopenia. Okay, leukopenia is very common in patients undergoing chemotherapy or radiation, those are the drugs. And this one actually shows monocytes, okay, monocytes and lymphocytes. These are some of the examples of leukemia that I found, like acute lymphocytic leukemia. So you have a lot of lymphocytes. Chronic lymphocytic leukemia, again, a lot of lymphocytes. Acute myelocytic leukemia. Okay, so this is monocytes. Okay, and then monocytic leukemia, again, monocytes. This is a cell. This is a smear of mononucleosis where you can see these are macrophagic, right? So those are also monocytes. Going to platelets, platelets are not real cells. They are fragments of cells called as megakaryocytes. Mega means big, karyon means nucleus, cytes means cells. So these are this is a cell which where the nucleus has divided and become really big, right? So megakaryon, and then it shreds into little pieces once it enters the bloodstream. So it is essential for starting the clotting process, and people who don't have enough platelets, it's called as thrombocytopenia, they can easily bleed. So these are anucleate, they degenerate very quickly, and the formation of platelets is regulated by, again, another chemical called as thrombopoietin, again, produced by injured cells. So they do arise from hemocytoblast, but their development becomes unusual where the cell divides repeatedly but doesn't go through cytokinesis. So it forms a megakaryocyte, a huge cell with multi-lobe nucleus and a lot of cytoplasm. These cells undergo numerous nuclear divisions without cytokinesis. After they are formed, they go to the sinusoids, they press against the sinusoids, and then they send like these cytoplasmic extensions, pseudopods, into those gaps in the membrane of the blood vessels. And then once they move in there, then they are shredded into little pieces as the blood flows. Okay, and then these fragments become platelets. All right, so here you have. So here is the blood vessels. Okay, so the megakaryocyte that just goes into this gap that is there in between the cells of the blood capillary, and as the blood rushes through, it just makes little copies or little fragments of the cell, and those little things become platelets. So here we are. So we have the hemocytoblast becomes a megakaryoblast, pro-megakaryocyte, then megakaryocyte. So this is the bone marrow, and then suppose this is your blood vessel, then this goes into here, it sends its cytoplasmic extension into this, and then the flowing blood is going to rip them apart, forming small platelets, small fragments called as platelets. So blood clotting, and we will talk a little bit more about this in the next slide.